Bismillahirrahmanirrahim. Assalamu alaikum. A 60-year-old woman, Gravida 3, Para 3, come to the office due to shortness of breath. Over the past 6 months, the patient has been finding it progressively more difficult to take deep breaths. She has also noted that she cannot fit into any of her pants lately despite a decreased appetite or nausea. The patient has a history of type 2 diabetes and has never had any surgeries. All her children were born vaginally. Routine mammography 4 years ago was normal. The patient has a sister with breast cancer, a BRCA mutation positive. Physical examination show an ill-appearing woman with a distended abdomen and decreased bowel sound. The lungs are clear on auscultation. Pelvic examination show a firm nodular non-mobile mass and the left adnexa. A pelvic ultrasound performed and confirmed the physical examination finding. Which of the following is the most appropriate next step in management of this patient? Exploratory laparotomy, hysteroscopy, imaging guiding biopsy of pelvic mass, loop electrosurgical excision procedure, myomectomy. So this patient, 60-year-old woman, came to the office due to shortness of breath. From the past 6 months, she having difficulty in breathing. Family history is positive for BRCA mutation in her sister. On physical examination, we show that she is an ill-appearing woman with distended abdomen and decreased bowel sound, which resemble ascites. Pelvic examination show a firm nodular non-mobile mass and the left adnexa. Based on these symptoms, what is the diagnosis of this question? The diagnosis of this question is epithelial ovarian cancer, and the management for the epithelial ovarian cancer is urgent exploratory laparotomy. Why the choice A is the correct one? Because epithelial ovarian cancer primarily occur in postmenopausal women. This woman is 60 years, and those with a family history of ovarian or breast cancer, as this patient having a firm non-mobile pelvic mass with nodularity in a postmenopausal patient is concerning for epithelial ovarian cancer that had extended beyond the adnexa. The patient has symptom of ascites. For example, this patient having shortness of breath, the decreased appetite, abdominal distension, decreased bowel sound, which is likely due to peritoneal spread of cancer, causing increased capillary permeability. Imaging, for example, pelvic ultrasound is done to confirm the presumed clinical diagnosis of ovarian cancer and ascites. And for metastasis, exploratory laparotomy with cancer resection and inspection of the entire abdominal cavity for metastasis is required. Come to the incorrect one, hysteroscopy. So hysteroscopy is not indicated as epithelial ovarian cancer does not cause intrauterine pathology. Choice C. Image guiding biopsy of the pelvic mass in such cases is contraindicated because during biopsy the cell will leak out from the cancer and will do harm to the body and will metastasize to the other part of the body. Choice D. Loop electrosurgical excision procedure. So a loop electrosurgical procedure involve removal of cancerous or precancerous changes of the cervical transformation zone. Choice E. Myomectomy. Myomectomy is for the removal of the uterine fibroid. If this patient doesn't have uterine fibroid, so myomectomy doesn't need to do.